Now the NRP. Why is NRP the most important? Is because it is the start of the life. Okay, when the baby is born, we expect a normal physiological few changes, which helps the baby to breathe and to continue its life process. So here, the initial few minutes, or rather the first minute, is the most important. And the most important problem with which the neonate faces is birth asphyxia. Okay, why is birth asphyxia most important? Because it has long-term neurological complications and may lead to the death. Okay, family would be expecting a baby, and these changes, this if we can avoid by neonatal resuscitation, which is a simple, inexpensive, cost-effective method. Okay, so all the doctors, okay, whether at the primary first level care, second or third level care, whosoever is attending the uh, delivery are supposed to know the basics of the neonatal resuscitation. Take it. So if we do not initiate it early, do not anticipate it, and incorrect use of methods would lead to a drastic means untoward outcome. Okay. So here, so as I have told you, the golden minute, the first minute of the birth is the most important. It is related to the anxiety of the parents as well as the health providers. Okay, this is here we expect a transition from intrauterine to extrauterine life. Okay, the physiological changes. Okay, majority of the newborns, majority, say 85%, do not require any resuscitation or a minimal resuscitation. Okay, stay in the say in the form of stimulation, but 10% requires resuscitation, initial stimulation, drying, and then positioning of the airway. Then 5% of them would require PPV, 1% would require intubation, and 1 to 3 of them might require chest compressions and emergency medication. So, if we do the initial, the first part correct, the later part comes down. Means the stimulation and drying, if it is done properly, and PPV is done properly, if at all required, the later part comes down. Okay. So here, see, this picture represents how it goes. Means the first one, wherein most of the babies do not require. Okay, and if at all, for all babies, we have to do this. Okay, whenever the baby is born, immediately we do the basic warmth. We provide the warmth, appropriate temperature, clean the baby, position the airway, dry and stimulate to breathe for the to help baby the breathing. Okay. The next is supplemental oxygen if required. Okay. Then assistant positive pressure ventilation. Then intubation. And as you see, it comes down. The requirement comes down lower down. It is the chest compressions and medications. So the next one. Now, what is the difference between neonatal resuscitation and adult resuscitation? Means adult, if we follow the adult one, adults usually it follows as CAB. Okay, compressions, airway, and breathing. Why compressions? Why chest compressions? Because for them the cardiac problem. Okay, the coronary blood supply problems are more related in adults than in newborns. But in newborns, we follow A, B, C. Okay? The airway comes the first. Airway. Okay? Just remember you have to ventilate the baby first. Okay? So airway, then breathing. If the baby is breathing, then we go for the cardiac thing. Okay? So airway, breathing, and circulation. Circulation.